So I'd like to move on to our next presenter, Dr. Dave Fearon. He works part-time as a family doctor on the Isle of Leewey in northwest Scotland. His academic interests include case study and qualitative research, global palliative care. He worked in palliative care in West Africa until 2019, where he completed his PhD exploring the experience of women with advanced breast cancer. He'll be talking about research partnership with Global Health Academy. Thank you.
Great. Thank you very much. It's a real privilege to be here. And it's wonderful for me to be able to talk about collaboration, because there's so much been on evidence already. For example, just what we've heard has been such a collaboration between different groups and different people. And even today, we're at the fruit of a whole collaboration from SUNITA, from their very funding stages to the implementation, to the data collection, and even the organizing of this wonderful conference today. So I've got the privilege today of talking about the research sort of collaboration, and it's been a great pleasure to be involved in that. So I'm here representing what we call a Global Health Academy, which is part of the University of Edinburgh, one of the oldest universities in the world. And it's been we've had a real passion for global health for many decades. And specifically for palliative care as well. So it's wonderful how we've been able to continue that, and how we've been able to be here and seeing what's wonderful about the SUNITA project and Nepal. You may wonder what's the connection between Nepal and Scotland. We're currently standing higher than the tallest point in Scotland, which is quite bizarre. Scotland's also part of an island, so we're surrounded by the sea. Nepal's not. But again, I think what we've seen in the SUNITA project are some of the core things what hold us all together. And as we look at palliative care and people's need for palliative care, we can just see what really unites us in humanity. So this is the some of the team, not all of the team. So we are a part of a team. And so the University of Edinburgh, it's not just people from Edinburgh. We've actually been able to group together a group with experience and competencies of people so we've got people with experience of palliative care and refugee crises. We've got people with experience of finances around palliative care, stakeholder engagement, and also geographical regions. We've had people with Bangladesh, India, East Africa, North Africa, West Africa. So we've been able to bring a whole group of richness to it. However, I wouldn't go so far as saying that we're the experts. And it's been a real privilege for us to be able to work with who I would say those are experts, who you've heard from earlier today when they were presenting there. And it is incredible just for us to see the caliber of people who have been involved in the SUNITA project. I would also want to highlight as well how with this project, it's also being able to hear the voices of the people who really matter, the real experts about what does it actually mean to have palliative care needs. And that's the people, the patients and the people who care for those with palliative care needs. And as we heard earlier, that they managed to capture some of the voices of over 2,000 individuals and nearly 600 households. And as we went through all of it, there was a lot of data there. And that data will hopefully be published in a format, hopefully in a peer-reviewed journals and different conferences where you'll be able to digest it a little bit more. But that's about surveys, it's about quantitative data, it's about the pause, about the SPICT, but also interviews, really capturing the voice of people that really matter, who are the center of this collaboration. So we were very much involved from the very beginning of just helping, shedding lights on different angles of how to look at this. This is pictures of we were looking at the data analysis through the transcripts of the interviews. And I think the foundation of a research collaboration has been very much a mutual respect, mutual learning. It hasn't been us telling people, it hasn't been us teaching the team, it's us been working very much together, which has been a real joy. And you'll hear more from Professor Liz Grant and from Jane Bates, who are here, part of that team as well. Unfortunately, the other two of our colleagues who weren't able to make the conference. So collaboration for me is about being helpful. And as I said before, about respect, humility, and mutual learning. I often use the example of our phones. So our phone is getting messages from many different satellites. And so a traditional way of looking at collaboration was more kind of this scientific fact finding. Okay, right, we'll look at it different ways and we find a fact. So my phone is currently getting data from different satellites, and Google Maps will know exactly where I am on the world. However, I think that misses some of the complexity of what we're dealing with here. We're dealing with, oh, there's so much in just people's experiences. You've got the geographical region, you've got the political, you've got the finances, you've got the employment, you've got all these different things. And I think just pretending that was a simple solution in somehow misses it. And I think in some ways we're not just looking for one fact. And I think what I prefer the term is crystallization. And so what this does is you can see the crystal, the light going through it, and everyone who's looking at it from a different angle has a slightly different angle. And for me, that's been the joy of a collaboration and a research of just being able to step a little bit to the side and just say, oh, me, with my cultural background, with my faith, with my background, everything about me, I look at it this way. And then somebody else will look at it this way and say, oh, but I look at it this way. And in some ways, it's not, again, there's certain facts which we'll come to, but a lot of it is just looking at a slightly different angle. And I loved the question earlier from the audience saying about, well, what is good in the culture, what we can use as part of providing palliative care? Because it's true. And there's so much positives, but sometimes you need an outsider to say, wow, that happens in your culture. And then the researchers are like, yeah, that's normal. And you kind of think, well, no, that's not normal. That's really special. And so it's that sort of collaboration, that sort of joint learning, looking at things from a slightly different angle allows a richer understanding of the complexity of what's going on, but hopefully also some of that solutions of going forward. So I do have to say that although I've got talking about these different views, different worldviews, different points of view, there are different facts. So, and I think it's important that I'm not saying there's no right or wrong, but there are certain things which have really came out of the data, which are really interesting, but also really useful as the Sunita project moves forward and palliative care becomes even more established in Nepal. The first three there about non-communicable diseases, frailty, and musculoskeletal problems. In my own clinical practice in Scotland, it's very much cancer. And in some ways, we've got that disadvantage that actually our palliative care was so entrenched in cancer, it's really hard to move out of that. Whereas here in Nepal, you've got that opportunity to say, oh, hang on. Yes, we have a few cancer, but you know, in rural areas, these are the issues. So you have got that opportunity to create palliative care collaboratively by yourselves, and to say, you know, this look like as we move forward. And that's a real privilege for you guys at the moment. I've written there as roles of daughters-in-law. Just more as a reminder, as I was looking at the data again, it's like, wow, these daughters-in-law do so much. And it's a real, they give and 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 they give. And it's just incredible. And it was interesting where I live, it's on a small island. And even though it's a completely different context, I've noticed that where I live is quite a reserved, quite traditional area. And it's actually the females as well who are there providing the care as well. Completely different, but it's just research has also helped me to reflect on my own practices and my own experiences back at home as well. And that's the other thing about collaboration, is that it helps us to reflect on ourselves and to learn about ourselves and our own biases, our own prejudices. And so it's always useful. What do we learn about the problem? What do we learn about the solution? But also, what do we learn about ourselves? As we always kind of collaborate, there's always, sometimes it can be a bit of friction, but sometimes that's a positive because it makes us self-reflect and say, well, what am I learning here? And also we've got the need for communication. So obviously listening to the voices of people caring for those with palliative care needs, there's such a hunger for information, a hunger to understand. And this is linked to the access of healthcare, which we've already talked about. And we look at the remote area, and we did we showed a photo before of where we actually visited, where you're doing the research. And you kind of stand in one point and you look at it and you, oh, there's a clinic over there. That's not very far away. But then you realize you have to go very far down, very far up, and the terrain is very difficult. So, and so it's kind of a communication. Well, do the families, do they know, do they understand where they should be going at different stages? And also resources as well. I think wherever you go, even in Scotland, people will say, what's your challenge? Or we need more resources. So you always have that challenge. We always need more resources. And again, it's getting that balance. Yes, we need more resources. We need more allocation for palliative care because palliative care saves money. We maybe haven't covered that yet, but that is something which is evidence-based and is being published, that good palliative care saves money for the family, but also can save money for the health service and the government. But we've also got that balance of, well, okay, right, we always want more resources for palliative care, but coming back to that question in the community, well, what resources do we have and how do we make the best use of that as well? So resources, yes, we need more, but also, well, what do we have and how do we make the best use of that as well? And the advantage of collaboration, when we're kind of talking about the international collaboration, is the creation of data and big data as well. So we've already talked about how much data the teams have been producing. And that's actually really useful for us to understand for Nepal. We've just listed some of these challenges as we're moving forward. We've got the Sustainable Development Goal. How do we integrate palliative care, universal health coverage, planetary health, well-being, climate change? The list goes on. These are not simple problems. These are complex problems. And quite often you might hear the word wicked problems because there's such many layers of complexity that there's no simple one solution. But as we move forward and as we collaborate, hopefully we can get data to understand better situations here for us to apply that elsewhere. And this comes with the challenge for people in the room, if you are willing to be challenged. So how are you going to be collaborative in moving palliative care forward in Nepal? But also beyond that, the lessons we learn here, as we understand what does a Nepali palliative care model look like, what can we do elsewhere? How can we help other countries understand from your lessons from that collaboration? So for example, in Asia, Africa, Latin America, Scotland, I've already said that my research work here has helped me understand differently palliative care in Scotland. And it's that sort of collaborative approach, which we've seen evidenced already today, which is a real strength. And it'd be wonderful to see that moving forward as we build on more collaboration, combining resources, moving forward, establishing Nepali palliative care, but also moving beyond that to look on a global scale of advancing palliative care on a global scale. So thank you very much for your time.
Thank you very much. Thank you.